Recent election cycles have changed the makeup of the City Council, and one result is more efforts to address Boston's racial divides, including a proposal by our guest. His idea is for an independent office to monitor how racial divides are affected by city laws and executive orders, especially in areas connected with public health. To tell us about it is the councilor from Hyde Park, Rosendale, and Mattapan, and the chair of the Committee on Public Health, Ricardo Arroyo. Thank you very much for being with us, councilor.
Thank you for having me.
Well, I want to start with a term you used when you introduced this. You said this is about a public health crisis. What exactly does that mean?
So as defined, as we defined it using the BU Dean of Public Health definition, it's something that affects a large scale amount of people, has a big impact, and requires a large scale solution. And what we've found, and by we I mean the Boston Public Health Commission, has the data that shows that when it comes to racism, the actual act of racism, it has an impact on your health. But beyond that, racism by itself impacts all of the social determinants, all 26 social determinants that they recognize for people's health. Racism has an individual impact on all of those things. And so what we're finding is in the data, Blacks and Latinos rank at the lowest of all medical outcomes, so life expectancy, infant mortality, diabetes, asthma, all of these different health impacts. Blacks and Latinos rank at the lowest that they can on those scales. And so what this is doing, what the idea of this is if we understand that our policies and our systems and our processes are creating these results, then the opposite can be true. Our systems and our processes can alleviate those results. And so the plan is to address this crisis by putting together an independent office that sees all pending legislation, regulations, any initiatives that the City of Boston is doing, will review them, and will send back a public grading on it, similar to the Congressional Budget Office, where it will say this increases racial inequity, this decreases racial inequity, or it has no impact on racial inequity. And right now, if you wanted to make sure that a racial equity lens was being applied to something, you would have to depend on the maker of that thing taking that into account. But there's no guarantee that that's actually how those things were created or that lens was ever applied. This would create a guarantee. In other words, you wouldn't have to depend on the elected official necessarily doing that or the team of policymakers necessarily doing that, because there'd be a guarantee through the formation of this office that whatever comes their way, they'd look at it, they'd grade it on a racial equity score, and they'd send it back, and then the lawmakers and the folks who are implementing it will have to essentially make that public and work with the public on how to implement that in a way that actually decreases racial inequity.
Now, I'm sure some people out there will say, well, this is appealing to different constituencies, but on the other hand, when you break things down this way, doesn't that tell you more about a public health problem too? It
does. So for instance, there's a lot of intersectionality. And so just to be clear about what that means, women suffer worse health outcomes than men in a lot of cases. But what we're talking about specifically, the reason why race is so important, when you talk about socioeconomic impact on health, right? That's obviously relevant, and there's a lot of data on that. But what the data shows is that race independently, so you can be equally situated economically in the city of Boston as a person of color or a white person, socioeconomically exactly the same, but your health outcomes are going to be different. You could be a woman, and if you're a black woman or a white woman, your health outcomes will be different, even if socioeconomically everything else is the same. In the city of Boston, there's a 3 times as likely to have a black infant mortality than a white infant mortality rate. So the black infant mortality rate is 3 times as high as the white infant mortality rate in the city of Boston. And so understanding that if you get into a place where you're lowering racial inequity, you're actually making these impacts all across the board. There's 26 social determinants of health. So for instance, if you look at something like city contracting, where we have a policy in a process that has created a 99%, less than 1% of those contracts, those city contracts, go to people of color or women. That's a process, that's a system, it's creating those outcomes. If that system, if this office had existed at that time, this system would have flagged that as something that would have created these outcomes, that would have led to these outcomes. The idea is to make it so that as we move forward as a city, we're no longer given the opportunity to say, oh, I didn't see that was going to happen that way. We're making sure that these things are making sure that racism as it impacts individuals is at the forefront of every decision we make, specifically racial inequity that's built into our systems.
Well, one example you gave was this long practice of hair testing for drug use in the Boston Police Department, and that was litigated for many, many years. The city spent a lot of money trying to continue that practice. How do you think that story would have been changed by what you're proposing?
So ideally, the idea behind this, and there's space here, right? We're going to hold a hearing, we're going to have experts in the field talk about this, but ideally, something like that, a regulation that would have been sent to this office, they would have come back and they would have been able to say, we've applied a racial equity lens to this. We believe that this will have an impact unduly on African Americans and folks who use hair product that is specifically made for folks of color's hair, right? And so when you get into those kinds of thought processes and those kinds of it's a different way of looking at problems, it's a different way of thinking for folks who don't naturally do that. This would ensure that it happens. And it would have a separate effect, which is if you're trying to send things to this office, right, of which we're trying to mandate that everything does go to this office, anything that has an impact that's a regulation, an ordinance, or a policy. If you're doing that and you know that this office is publicly going to say this has an impact on racial inequity, and it came back and said this is going to increase racial inequity, if you're a politician or a policymaker, that's unacceptable. And so what would happen is, ideally, folks would say, I need to put together policies and regulations that don't come back with that finding. And so we're guaranteeing that that analysis happens both at the back end, but eventually at the front end as well, because nobody wants to publicly push something that increases racial inequity.
One other area I'm very curious about is stops by police. There's definitely a racial disparity involved.
Yes.
Some people will say it's justified, some people will say otherwise. Could this office do something on that?
So I was a public defender for a very long time, and our FIOs, our field, essentially
field
what people
interrogation, right.
what people consider stop and frisk, that all of those things have a mental and emotional health impact. And I think what gets lost in that is the way that affects people's stress levels, the way that that actually causes health outcomes. When folks live in a cloud of anxiety or are nervous about how systems are going to interact with them on the basis of their race, that creates health effects. And so something like this would look at certainly the policies that we put in place to police our communities, the policies we put in place to protect our communities, and it would make sure that when they do that, they're making sure to evaluate the racial inequity, what this would do overall to the racial inequity that already exists in so many of the different things that we're doing. The idea here is to reverse. The way I talk about it is, you know, when we talk about white supremacy and racial systemic injustice, it's existed generations. It's existed my father's generations before him. It's been with us since the creation of our systems. The opposite can be true. If we create systems that actually counteract that and make more just systems, and we ingrain them into our systems, that can last for generations just as well. And so the idea here is to get to the systemic, the larger part of that, and ensure that as we do everything, that we're looking at it through a racial equity lens, because the reality is in the founding of our country and in the founding of our city, race and how we see it and how we let it reflect our institutions and who's allowed to participate and who's not has had these lasting impacts on health and on health, wealth, and any number of different determinants that you could think of for success in America. And so this is a way to make sure that with that in mind, we're doing a real gut check on everything that we put forward and making sure that we impact it in a positive way.
This is BNN News. We're talking with District 5 City Councilor Ricardo Arroyo. Councilor, on an even faster track, the city and many countries around the world have to deal with COVID-19. What's the first thing the city should be focused on right now?
I mean, it ties in very much into what I was just talking about, right? The racial equity lens. I'll give you an example as it applies to COVID. When we talk about school closure, close to 70% of our students rely on the food that they're receiving at these schools. A number of our parents of these children are unable to have somebody at home, so we're talking about the loss of work time, the loss of all these different economic impacts. And so when COVID is coming in place, and it is, where we're in the middle of preparations and planning on how to address it on a number of different ways that are changing, frankly, in scale daily, it seems. But when we have these conversations, how are we looking at those most vulnerable? How are we looking at how folks who don't have contractual jobs that allow them to work from home? How are we looking at it for our youth who don't have the ability or the resources at home to be schooled at home? How are we looking at all of these different things and taking all those into account? I think right now, a lot of the planning that's happening is how do we reach these populations with the resources they require? And that requires looking at it in a different way.
One other part of this, maybe it's not totally under the city's control, maybe not very much of it is actually, there were many immigrants here, varying statuses, and their access to health care this is going to be a real dilemma for a lot of people.
It's going to be a large dilemma. I think the other thing that I'm very aware of is the census, right? We're going to have to be doing a census count, and everybody being self-isolated and self-quarantined during that is going to make that incredibly difficult. I think, when you think about its impact on elections, when you think about its impact on all these different places, we're sort of in an unprecedented place and time in the city of Boston. As we move forward, a lot of the planning that I'm personally in my office trying to focus on is how do we connect folks to resources. So for instance, we have restaurants, local small owned restaurants that are saying we're losing all our corporate bookings. We're losing all of our, we're not getting the staff in here that we're supposed to have. We're not having the kind of folks coming in that would sustain this business. And so we're looking at closure. What's happening on rents and evictions, right? I would push for a moratorium on evictions. And frankly, I think in some places they've even pushed on a moratorium on mortgages. As we move forward with this, there has to be some plan in place that recognizes that when you're talking about pandemics, we're only as strong as the one who's least protected amongst us. They don't discriminate that way. You can't buy yourself out of a pandemic, and there's no wealth there, right? So when we see these problems with hoarding and all these different issues, if we're not planning to take care of and protect those most vulnerable in our communities, which happen to be immigrants, people of color, folks lower on the socioeconomic scale, then we're not really planning to deal with this properly.
I know it seems almost like a long time now, but way back on Super Tuesday, you were part of a challenging slate for state committee. A lot of voters saw all these names and goes, what does this mean? I mean, does this make any difference?
So there was a lot of engagement on that. And so what I would speak to that really quickly, I was on the Ward 18 fresh slate. There was another one in East Boston and several other challenges in the city. And the whole purpose for that was to engage at a grassroots level in a way that we haven't really before. I think when you see things at the federal level deteriorating in such a way, the idea is, well, let's build the bench. What does it look like to actually create a grassroots organized community that is vetting candidates, that is vetting social issues, that is basically being involved in the community beyond just voting on election day? And that's what this was about. And I think the community itself spoke in a very large way. I think it was a 2-to-1 margin, that this kind of activism, this kind of engagement was something they were seeking, something they were wanting. And in Hyde Park specifically, and in Ward 18, which is Hyde Park, Mattapan, Rosendale, they hadn't seen that for years. And so now I'm excited to be part of having a very active committee. I think 2 years ago or a year ago, they had 2 meetings the entire year. And so some committees in the city do much better than that, and my hope is that this would be one of them.
Thank you very much for being with us.
Thank you.
City Councilor Ricardo Arroyo. In a moment, we'll tell you about a relief effort in Roxbury in response to the coronavirus. But first, this message.